Hi, everybody. Here we are. It's Wednesday, and so that means we're here for a story. And we got a Halloween story for you since Halloween is coming up in a week and a half, maybe a little bit from here. So we're gonna probably do a couple of Halloween stories just for have some fun with them. And then I'm gonna after our little story, I'm gonna kind of talk about what's going on in the city with COVID and our numbers and how we need to be taking care of ourselves and our families. All right, so we're going to get started. I hope everybody is ready to go. We're going to take a look. As usual, I'm using the El Paso Public Library, and they got still quite a few stories available at this point. They got some new ones, so that's going to give us a chance to do some new stories here. So here we go. This is Frank Was a Monster Who Wanted to Dance. All right. And this is by Keith Graves. Frank was a monster who wanted to dance. I know I could boogie if they gave me a chance. So he put on his hat and his shoes made in France and opened a jar and put ants in his pants. He drove to the theater and jumped on stage. Then he danced like his shoe size instead of his age. Frank shook his shoulders and strutted his stuff. The audience screamed. They couldn't get enough. Frank did a cartwheel. Frank did a flip. Suddenly, his head began to unzip. Uh-oh. Out flopped his brain, which plopped on the floor. Eek! Which loosened his eyeball, which rolled out the door. And after his arm fell off out of his sleeve, the horrified audience started to leave. But Frank kept dancing. He said, "What the heck?" and laughed as his head fell off his neck. I might be a monster, but man, can I dance, he said to himself with one-eyed glance. That's the end. That is Frank Was a Monster Who Wanted to Dance. Short little story, but it's a cute one though. It's kind of to get everybody in the mood for Halloween. I know Halloween's going to be a little bit different this year, but we're going to go ahead and discuss that next week about little things that you can do to celebrate Halloween, because it is a completely different holiday this year because of what's happening with COVID in the community. As many of you know, that the numbers have been increasing quite dramatically here in town, number of positive cases. I've been seeing, my colleagues have been seeing a lot of more positive cases. We're seeing entire families who are becoming positive, and this is a big concern because we're working on our resources are dwindling at this point. Our resources are being overworked, and so our hospital personnel is limited. Beds are limited, ICU beds, and I'm not just talking about ICU beds for patients who have COVID. We still have people who have heart attacks. We still have car accidents. We still have other medical conditions that require ICU care. So when they say that the ICU beds, we only have X number of beds left, it doesn't mean just simply for COVID infections. This is for everything, for any type of medical illness. So we're getting into a really precarious situation here. And with that being said, though, the more people that are sick, we need more staffing. So our staff is being stretched. At this point, I know that they're starting to bring in nurses and therapists, respiratory therapists, and stuff from other cities are coming in. The military has sent some nursing staff to some of the hospitals here in town to help alleviate that strain that's being placed on the healthcare workers. So we are really we're in a situation where we all need to do our part. I know COVID fatigue. It's real. We're all feeling it. Everybody's frustrated. They want to go out. They want to be able to have family gatherings. You want to go have dinner, go catch a movie. We can't do that right now. We can't. Because most of the kids that I've seen that are positive have gotten it from a family member. Family gatherings. If you don't live with the person, remember, if you don't live with the person, you need to wear a mask and you need to keep your distance. Masks are not 100%. You may see people are complaining, well, masks, aren't they supposed to work? And, that they don't kind of believe what's happening here, and they feel that masks are unnecessary. Masks are not 100%. But masks, along with distancing and hand washing, we can at least reduce our risk. And that being said, though, that includes family members. And we have a tendency to drop our guard when you're with family. You figure, well, it's my cousin. They're fine. They don't look sick. That's not completely a true statement, because they could be positive, but without symptoms, and they look well. They're their cousin, and they're safe. That's not necessarily the case. I've had family members, several. The kids got sick from dad, who happens to go to work, and now he comes home. He's sick, makes mom sick, and all the kids are sick. They're getting it from their family members. This is one of the biggest sources, is from other family members, people that you know. Now, the other issue is gathering in confined spaces. Okay, restaurants. I know bars have gotten around this mandate of by opening up as restaurants. Well, when you're in a restaurant or a bar, you're eating and drinking, you have to remove your mask. You're in a confined space. There's no place to distance. So the more people in a space, your risks are increased. The air circulation, actually the air conditioners, the virus it's aerosolized. It can be recirculated. So these are the areas we need to avoid. Restaurants, I know they're still open, that they can have 50% capacity, I believe, but play it safe, to go, get it delivered, enjoy it at home. At this point, even outside, I was, before, I would, every once in a while, I would go out to have lunch. I would always pick an outdoor restaurant where I can distance myself. At this point, I'm not comfortable doing that. I'm going to everything's to go for me at this point. So we do need to take precautions. We need to take these mandates seriously, and we all need to do our part. Wearing masks properly. We do have a listing of the masks that are appropriate masks here on the building. So if somebody wants to come by, just take a look to see what our masks are. But we will not allow people in with masks that have valves. The valve is not going to protect you. The valve is designed simply for you to be able to not get particles in, to breathe the particles in. But the coronavirus will go through that little valve. Now, remember, the reason why we're wearing masks is to hold in our droplets so we don't spread them out to other people. Well, with that valve, it allows you to breathe out. That's why people like them, because they're easier to breathe in. As you can see, I've been sitting here with this N95 mask. This is one that's required for medical professionals. I'm not having any trouble breathing, okay? It is a little bit more difficult in the sense that I have to put a little bit more effort, but it's not unsafe. So people like those valve masks because it's very easy to breathe in and out, but that's not safe for you or anybody around you. The gator mask, there's a bit of controversy about the gator mask because they're more of a lycra, so they stretch and the particles the spaces in the material become wider, so they may be able to expel. If someone is asymptomatic, they don't know they're sick, they don't have any cough, but they're expelling their droplets. This is a risk. If anybody in your family you've been exposed or has been tested, and you feel like you've had contact with that individual, and you decide to go get tested, or you call us and say, we need you to go get tested, you have to understand, though, that there's a time frame. So if you got exposed to a family member on Monday, and then you just said, well, I'm going to go on Tuesday to get tested, you may have a false test. But that doesn't necessarily mean you're not infected, because the time frame for infectivity can be up to 2 weeks. Most people, we're recommending you get tested no more than maybe 5 to 7 days after that contact, because that's when you may start either have symptoms or you're going to test, your test will be a bit more accurate. But once you get tested, you need to quarantine. If you think that you could possibly be infected, that's why you're going to get tested, right? You need to assume that you are positive and you need to quarantine. That doesn't mean going to the store, going to meet family members as you wait for your test. Because in that time frame, you can be asymptomatic. And now you're spreading it to other individuals. And then now on day, you got tested on one day, now 4 days later, now you're feeling sick, but you haven't gotten your test results back in, but you're feeling sick, and those other days you've been out and about, you've just actually potentially exposed several other people to the virus. And then your test comes back positive. This is one of the most difficult issues with this virus, is that you can be asymptomatic and spread it to other individuals. By taking precautions, by wearing a mask properly, covering your nose and mouth. It's got to fit properly. Washing your hands, keeping your distance. We can reduce. It's not 100%. We know it's not 100%, but we can reduce the infectivity, the spread of the virus. And that's what we need to do at this point. We are in a precarious situation. We really are. And it's unfortunate that we've had to have some more mandates. I know the city is closed, limitation on the hours of restaurants and such. But unless we do our part, this is not going to get better. We still have flu. We're entering that flu season. We don't want flu to be a compounding infection along with COVID. So if you haven't had your flu vaccine, please give us a call. We've been having some flu clinics on Saturdays. They've been filling up quick, so you do need to call, but we are still trying to work in as many people during the week as well as on the Saturdays that we have available to us to vaccinate the kids. We need to stay up to date on our vaccinations, and we need to get everybody, all family members, vaccinated for flu. 6 months and under, moms, dads, grandmas, grandpas, whoever's in the home needs to be vaccinated, because 6 months and under cannot receive their flu vaccine. We're going into the colder part of the year. More people tend to stay indoors. What's this going to do? Remember, indoors, lots of people, you're more likely to spread illness, not just flu, but COVID as well. Okay, and we still have other viruses in the community. Being that said, we also need to keep kids up on their vaccine schedules. We don't want them to fall behind, because there's pneumonia, there's meningitis, there's other viruses and bacteria out there we need to cover you for. So please stay on top of those vaccinations. If you have a concern, give us a call. We'll let you know if your child is behind or what we need to do to get them taken care of. All right. I know this was not as fun as our cool little story about Frank, but I need to address it. We need to all do our part, moms and dads. And please remember, if you get tested, please quarantine yourself. Please do not go out and about into the community until your tests are in. If you get those results back or you're feeling well, because that's a time period that you could be spreading. So if you get tested, assume you're positive until either your symptoms have all completely resolved, and we can go into a little bit more detail with that. If you want to give us a call, I can help you with that in terms of your time frames and such. But if you get tested, assume you're positive. Assume you're positive. Quarantine yourself until your test comes back, or give us a call about symptoms, and I can kind of guide you in terms of time frames that you may be able to enter the community, but with precautions. All right? So I'll have another Halloween story for you next week. We'll have something fun again, and we'll talk a little bit about Halloween and maybe how we can have a safe Halloween. It's just different this year, but that doesn't mean we can't have fun. So everybody have a good day, good week. Wash your hands, wear your mask, take care of each other. All right? We'll see you next week. Bye-bye.